Pandit's cases just now. I was in panic, but we have managed to sort it out, albeit, I think 6 minutes late. So please forgive me for this. And we are on, and that's what matters. What happens when COVID comes a knocking? Have we really ever thought about it? Have we faced the fact that we may one day be victims of this absolutely enigmatic and horrific virus that never was known to man before 2020? Um, yes, some of us do suffer from anxiety and stress, and we, worry so much for our elders, especially for our children. And that's one of the reasons I did this webinar today. And also, I think lurking in the background with everything that we do in this day and age is that COVID syndrome that's happening for nearly 8 months. And some say that it started in China in around July or June of last year. Well, we'll never know. But I have organized today's seminar because of you all, my friends, my ISKCON sisters, my COVID group, my Sangeet group, all the beautiful people who egg me on and make me do and motivate me to do all the things that I do. So first of all, thank you to all of you, beautiful friends in my life and my beautiful ISKCON sisters. Thank you for being there with me and giving me the impetus and the motivation to be who I am. And it's with your good wishes today that I have two very illustrious and very dear people who are so generous to come and share their reservoir of knowledge with all of us. I'm going to start with a man who is not only a very beautiful doctor, but he's also a dear friend. And what differentiates him is the fact that he's so generous, he's so giving, he's so guiding. He's been a friend, a guide, a mentor to me personally. The very eminent ENT surgeon, ENT specialist, and a person who has a fabulous hospital, Dr. Ashesh Bhumkar. Did you know that Dr. Ashesh Bhumkar actually has a specialization in reconstructing ears for children who are born with deformed ears or without ears? Now, I didn't even know that that was possible until I met Ashish. And can you imagine what a brilliant career this is to transform the lives of unsuspecting little children who come with such a grave deformity? Now, this is apart from the fact that he's doing a lot of work in COVID times. He's a COVID warrior and is selflessly putting himself at risk, like all the beautiful COVID doctors that are saving the world today. And I hope, especially in India, we can remember that, respect them, and they are the gods and the devis that exist in our lives today. And that brings me to a very special person today who's here with us, who's taken the time out from being an intensivist, from saving the world. I was introduced to him by our very generous Ashesh Bhumkar. He's Dr. Rahul Pandit. Now, obviously, you've heard of him, and you've also heard that he has saved hundreds and hundreds of people in the ICU. But what also makes him very special is that he himself went through COVID, and he was very vulnerable and very straight up about the fact that it even gave him such a great specialist. It even gave him sleepless nights and a sense of worry. And he's going to share that with us. But for those uninitiated, let me very correctly introduce him to you. He's a leading intensivist who's healed hundreds, maybe thousands of very severely affected pandemic patients, COVID patients. But nothing quite prepared him to face the SARS-CoV-2 himself when it struck him. As a critical care physician and a very eminent one, he will later share with us how he went through all sorts of thoughts, he says, as the doctors put him on oxygen support. We are all vulnerable after all, isn't it? Dr. Pandit is also a member of the state's COVID-19 task force and became a care seeker from a caregiver. It all started with a low-grade fever, says doctor, and that too during a week when he was not on COVID ICU duty. And this is something that should teach us, the next thing that he says. A breach never happens when you're prepared for it. A breach happens when your guard is low. And this is something he's telling us, and he's going to say it himself. And I'm going to give to you, Dr. Rahul and Dr. Ashish, a very warm welcome to both of you. I'm overwhelmed and delighted to have you here. I'm doing a COVID seminar after a longish time because there, everything was said and done. But Dr. Rahul, now we've come to a point where I think we know more about COVID, and there are lots of things that we thought we were so confident about that have been dismantling around us, like the COVID cocktail of medicines, like Remdesivir, which we thought was manna from heaven, like ivermectin, like Favi. Please tell me if I'm mispronouncing anything. So let's start with the resurgence of COVID that has led to a fresh lockdown all over the world. Or would you say, Dr. Rahul, and then Ashish, would you say it is actually a continuation of what's going on, and that the world took a bit of a lull and decided to give it a bit of a cold shoulder in the middle, but it's always been there and it's not a resurgence? Dr. Rahul.
Thank you very much, Nisha, for having us here on your live show. It's indeed a honor and a pleasure to be here with Ashish and yourself both. Um, so, coming to your question point straight away, what has happened basically is that when we saw the initial wave in the Western world, it was the end of their winter, which was basically there, the January, February, March months, when Italy, Spain, France, USA, UK, five major countries basically took a big hit, and then it spread to the rest of the European world. The virus is known to be the most active in the winters. And now, with the winters coming up again, with the autumn has set in, and you'll be having the winters coming up again, you basically are seeing the resurgence of the virus again. The virus never went away, it was always there. We all know that winter brings in all these viruses back, and that's why we take a flu shot just before the winter begins. So the H1N1, the common influenza virus, some of the other viruses which are known to be active during the winter season, are known to basically come across and give us a hard time during the winter time. And what helps this virus, the COVID-19, the coronavirus, essentially is that colder climate, it is known to survive better. The smog and the fog, whatever place you are, if you are in a polluted city, you would have the smog. If you are in a city where it has got a lot of fog, you will have fog. uh, Actually requires the virus requires a medium to go from one person to the other person, and these small particulate matters which are there in the environment, in a colder environment, actually promotes it, and that's why you are seeing a resurgence. Along with that, of course, there was a drop in the guard. So people started going out, people started mixing with each other, the social function started happening, the life started to slowly trickle back to the normal in the European world, and that's where the second wave has hit in. And that's what worries us in India, that we are approaching winter. Fortunately, we are sort of a mixed country where we have some tropical areas and we have some areas where the winter is quite harsh. So especially the areas which are northern part of the country, say above Nagpur, you have Delhi and the northern areas there. That's where the winter is going to be harsher. Plus, the climate is not very conducive. We know the Delhi fog, the Delhi smog, and the surrounding areas do get covered with the thick fog in the winters. And I really fear that this next 2 or 3 months would be the time where we have to be extra cautious, not let our guard go down. The numbers have gone down now, and we should not believe those numbers will keep on going down. We should always be prepared that there might be a resurgence of it if we drop our guard down. So the guard has to be kept up.
So, Rahul, are you saying that this period may be more virulent, or are you saying that we may handle it better because we know a bit more about the coronavirus after having, been around it for 8 months? And is it mildly clearer to us? Is the virus mildly clearer, or are we still at sea?
No, I think we know how the disease progresses. We also know that the virus is cleverer than us. The viruses have been in the world, though the COVID virus was not known to us before, but the microorganisms have been in the world billions of years before even humans stepped foot on the earth, okay, or they were evolved on the earth. So they have a mechanism by which they can actually mutate and change the way in which they function. So they may become more virulent and they may become less toxic. or it could be the other way around. They may be more toxic but less virulent. But whatever it is, whatever we have seen of the COVID virus up until now, we know that it's highly infectious, more so than the common influenza virus. That's why if you have one positive patient in a room, the others are likely to catch it up. Whereas you would go around before in our normal life with a person with a common cold sitting in our room, and most of us would not get it. And that was because the infection rate, the infectivity of that virus is not as much. Coming up to the point that where whether we are now better equipped to know the virus well or not. Yes, we are better equipped, and that's why we have the three vaccines which are with us, which I want to emphasize through your show. We have the mask vaccine, we have the social distancing vaccine, and we have the sanitization vaccine. If we don't utilize these three current vaccines which we have in our hand and wait for a mythical fantasized vaccine to come in whenever it comes in, then we are in trouble. So we need to be clear in our mind that what we have to utilize to the fullest.
Absolutely. Ashish, I want you to jump in here and tell me, there's a lot of videos doing the rounds talking about the danger of the vaccine when it does show up. Because normally a vaccine takes 2 to 3 years of trial to, to actually be efficacious and show what its side effects will be. So is that something one has to think about in the near future?
Currently, we this COVID has fast tracked everything, be it the medical care, be it the medicines that are coming as protocols, and more so the vaccine. I mean, rightly so, it needs to be fast tracked, but there is a certain flip side or a collateral damage in doing so. So there are reports coming, and probably Rahul will be able to comment more. But very serious but occasional reports of some serious neurological conditions. I don't know whether the statistically that number is significant or not, because
Right.
person or one patient does not make science. It
Right.
goes through the majority. So maybe Rahul can speak about, if at all there is a scientific data that is being out there. Rahul, about the side effects
Yeah.
that are potential.
So whenever a vaccine production happens, what we look at is three aspects. First is the proof of concept. The proof of concept is that you give a vaccine, the antibodies are developed, and there is some resistance to the disease. The second proof of concept is that it is safe. So it can be given to all age groups across the human race, and they will basically have no side effects. So that's the most important aspect of the virus of the vaccine production. And then the third is that it has a sustained effect. So it is basically going to stay at least for a year or so. That's how the flu shot is given, so that we are at least protected for 12 months or so. Because there is no point in having a vaccine which has to be taken every 3 months. It is not
Correct.
easy to sort of vaccinate everybody every 3 months or so. So we are at the phase where we are actually looking at a safety profile of most of these vaccines. If you would have heard a month and a half ago, the British found out, the UK found out that one of the patients actually developed a condition called as transverse myelitis. So they
Yes.
immediately stopped the vaccine production and the trials, beg your pardon, not the production, the trial on the vaccines. And in a
Yes.
day's time, they investigated the root cause of that case, found that it was unrelated to the vaccine, and then continued. Such small reports have trickled in, but the only instance where the trial was stopped was this instance where it happened in UK. Rest of the trials are actually going through a safety data more vigorously, and the committee which basically looks after the safety and efficacy of a trial have got very sharp ears and eyes, and they actually look at every complication in detail. So there may be minor complications which we will have to sort of put up with. For example, injection site pain. You may have a 24. Most vaccines when we take, we have a swollen arm or a painful arm for a day or so. But that's an easy side effect to be put up with, and say that, look, I'm going to have a pain for a day in my arm, but I'm going to be protected for the next so many years, so
12
many
months
months,
or
or
so.
so many year or so. So we have to balance the side effects and the effects very well.
Rahul, your speciality is ICU and what you've done, to cure hundreds and thousands of patients. So there's a lot. I mean, I've never had so many questions as have been pouring in since yesterday. So I have a deluge of them. But one of the key questions is by a very eminent doctor herself, Dr. Pikale, Sangeeta Pikale, wants me to focus on a lot of people believe that being at home is nearly safer. So, is it the case that a dog, when you get COVID, going to a hospital, which is probably got a lot of the virus, floating around. Firstly, does it have, is it dangerous to take yourself to hospital? Um, Also, if you are going to say that, it's very well sanitized, hospitals are safe, when is it and what is the deciding factor where you are able to know that, look, I can deal with this at home with, phone calls and Zoom calls with a doctor, or now it's come to a dangerous phase and I have to quickly check into a hospital. So what is that point of
Tipping point.
decision? Yeah, the tipping point. And what is your little tip on about hospitals? Are they safe? Should people feel frightened of checking into hospitals?
Look, it's been around since March. We have been basically inundated by COVID, and it's now almost 7.5, 8 months that we are into it. So for a first few months, you may put off on things which were non-essential. For example, a cataract surgery. I'm just giving an example.
Right.
Most people may not have an emergency cataract surgery, or people who Dr. Bhumkar sees regularly. People may have we may have some growths or something in the nose, or they may have a hearing defect, which they could put up with for a few days, 2 weeks, 3 weeks. But eventually, when it is going to basically have a problem with your organ function, so it could be ear, eye, heart, leg, knees, whatever, or
Yes.
it could be threat to your life, because there might be some vital organs which may be threat to your life. You will have to go to an hospital. You'll also
Right.
have to go to a hospital when even a small illness or a particularly innocuous looking illness like say flu still requires you to have care and observation for 24 hours, requires you to have medications delivered into your veins directly intravenously. So you would have to check into a hospital for that. So I think people should not be afraid to go to a hospital. Now, which hospital would you choose? Obviously, right now there are some hospitals which are COVID hospitals, which are designated as COVID hospitals. So obviously, you're not going to go to those hospitals unless you suspect that yet you have COVID or you have proven to be COVID positive. Okay, that leaves us with two hospitals, and one is the non-COVID hospitals, and the other are the ones which are majority of one, which are the hybrid model. Okay, I feel hybrid model is the best, because you basically have a hospital within a hospital where COVID is taken care of separately and non-COVID is taken care of separately, and they have strong processes which will basically separate the COVID patients or the suspected COVID patients right at the entry itself. So, for example, Fortis is I mean, I'm talking only about multi-speciality hospitals. I'm not
Yes.
talking about single nursing homes. So obviously, single nursing homes, I will come and talk about it. Maybe Dr. Bhumkar can talk about it a little bit more
Yes.
than me, rather. But bigger hospitals, I think it's better to be in a hybrid model hospital, because there is no place in the world today which is non-COVID. So how can a hospital be non-COVID? I just don't trust that. So a hospital cannot be non-COVID. If you have the entire world which is talking about COVID, your hospital also has to have the places where COVID will be there. So better to go in a hybrid model hospital. And Dr. Bhumkar could talk about smaller nursing homes up to
Rahul,
50 beds.
I,
Yes.
I think Dr. Sangeeta Pigle meant that when you test positive,
Hmm.
should you be at home or should you go to a hospital?
Is that what the
Correctly?
question was?
Yes, I think
That was
whether
part of the question.
part of the question is it safer to
Yeah.
be treating yourself at home, and at what point of your symptom score or whatever should
Yeah.
one seek a hospital care?
And also we intertwine the question that who can be managed at home
Yeah.
and who is better off at home and who should immediately look at going to a hospital apart from comorbidities. And if you can even intertwine into this question, a lot of patients who've got COVID have written into me about hypertension and diabetes. But a lot of people seem to be feeling that where does the lung figure into this? The lungs being weak is a major comorbidity as well. How is that? I mean, are people not looking at that, or should they be more cognizant of that?
Right. So the first question: who should be treated at home and who should not be treated at home?
Absolutely.
Right. So the first and foremost, the principles of home management are very clear. The principles of home management are that, do you have a comorbidity? If you have a comorbidity which is not controlled very well, which is not under control, and comorbidities are obesity, diabetes, hypertension, COPD, or you have a condition like a cancer for which you are receiving some chemotherapy which makes your immune system weak to begin with, those patients should not be treated at home. They should be in a hospital, no matter what their age is. Okay. The second set of people who would rightfully be treated at home, but there is a little bit of gray area, is those who are above 60 or those who
Right.
have comorbidities which are well controlled and they don't have any immunity problem to begin with, or they are not on any immunosuppressants as such. So I have taken care of patients who are above 60, 70 as well, who have successfully managed themselves at home, but it requires a daily consult with your doctor. It requires to follow every instruction of the doctor. It requires you to do the 6-minute walk test, which I keep on harping about, and some people now are bored of the 6-minute walk test as well. That you need to basically identify the hypoxia, the low oxygen in your blood before it actually becomes a problem for you. And those are the rules which you need to follow and have the medications as prescribed by a doctor. There is nothing called as self-treating. You have to be in under care of some medical practitioner. It could be a GP, it could be a specialist, it could be anybody, but it has to be under a doctor's supervision only. And then the most important thing is that you should have place at home where you could self quarantine and not spread the infection to other people in your house. So that means that you should have a separate room to stay in, preferably which has got an attached washroom as well. If you don't have an attached washroom, then there are some rules to sort of clean the common washroom which is there in the hospital, and when you are going to use it and after use what you need to do and stuff, so that you don't spread it to other people who are staying in the house. If
Right.
you have only one room or a very small house, I would prefer those patients, even if they are healthy, to go and stay in a corona care center, not a hospital, so that they don't spread it to their loved ones. This is the message behind it.
Dr. Rahul, when you're isolating, this is a very very generic question, and you have somebody leaving your food outside the room. You wash the utensils and sterilize them before returning them outside the room.
You just wash the utensils and wash it with soap and water. That's it.
Right.
Normal detergent and water, and you don't need to sterilize. There is nothing called a sterilizing utensils. As long as you wash them with the normal soap and water and dry it off, I think you're going to be all right. People can. So what I generally advise to the people is that keep the same utensils. Let people come and actually put food in those utensils which you're using every day. So there is
I
no change outside and inside the room. So you just keep
very
your
much
utensils
like a love.
outside, yeah,
Yeah.
and let
So
somebody come and
sometimes no, because these are very tiny details that
yes.
people don't remember.
Nisha,
So just line
can
with this same
can
question,
I make a comment?
please.
Sorry. Before or when the COVID comes knocking, first of all, be sure it's not going to knock you out in the first 1 hour or 6 hours or 12 hours. So no need to panic and suddenly think this is a death sentence. And I would like to on this forum say that each one should have a backup of a medical services and should start with your trusted general practitioner, a trusted local MD physician, and then the super doctors like Dr. Rahul Pandit. This should be a triple layered strategy that everybody should have. And for that, you have to sort of, keep in contact with the doctors as a standby. So you have to be very nice to them. You have to keep that network alive and not suddenly, because one person testing positive in a family, trust me, it's a nightmare for doctors. The whole family will now start getting itching in the throat. Something is happening. Now I'm feeling weak. Now this report, that report, minimum 100 calls and for 14 days. So one patient testing, it's a nightmare for the chain of doctors who are involved. And typically people will not trust one doctor. They'll send the same report to third doctor, fourth doctor, fifth doctor, and everybody. Don't do this. Create your own dependable medical healthcare system and then just trust them. I want to give this message because I'm sure Rahul is facing the same thing. And then there's too much chaos because we'll come to the medical protocol, but preparing this backup, which begins with your general practitioner, very, very important because he or she knows your system very well. He or she is accessible to you. They're local. This is a very important network to establish before it comes knocking. And the moment it knocks, talk to your general practitioner. Now, most doctors know the overall first aid that is required for COVID. No need to panic, and let that attending doctor first level decide, do you need to go to the second level? The second level will decide, now this is out of my hand, we need a Rahul. and Rahul could be on a phone or on a Zoom, not necessarily in the hospital, but this is the sort of a chain that one should follow.
So very important, guys. Please remember what Dr. Ashesh Bhumkar has said. Keep your network of 3-layered, go-to ready. Be prepared, even though you may give it a miss. I mean, hopefully,
sure, so.
Gives and you don't get it. But be prepared and keep that network ready. And please don't drive your doctors to, suicide by, 14 calls a day. Please follow what the doctors are saying today, because there's some pearls that we are getting out here. In consonance with what we've been discussing, Dr. Rahul, you mentioned the flu vaccine and the pneumonia vaccine. Can you just enlighten us as to who should be taking the flu vaccine, and should we all be taking a flu vaccine right now? And what is the distinguishing factor for taking a pneumonia vaccine now?
Yeah, so pneumonia vaccine is for people who have low immunity or who are basically above 65 years of age, 65 years of age, or who have got conditions like COPD, which is in common terms we call it emphysema, or asthma, who have high chances of catching up a lung infection. Those are the people who are advised to have a pneumonia vaccine, which I think their physician who normally looks after them can advise. The flu shot essentially is for almost all adults can take that. Okay, it is something which can be easily taken up, but most of us don't take it. If you go to a Western country, for example, you go to US or UK or Australia, they would actually advise a flu shot for all adults who are there. But that is not a practical solution in India. So all frontline people, all people who are actually working in a occupation which exposes them to multiple people, so doctors, people who work in banks, where you're actually coming in contact with other people, I think they can, all adults can have a flu shot taken up. Right now, I think we are waiting for the corona shot to happen. So I don't think anybody is actually interested in the H1N1. We've all not taken up the vaccine right now this year. I had taken the vaccine last November, I believe, or September, I believe. So I am actually due for a vaccine now, and it's now crossing my mind that I should think of taking it up now this month. I should be doing it now.
But it's a flu, it's not for COVID. This does not protect you. Just because you take the flu shot does not mean you have any extra protection against COVID.
Zero.
Mitigate, Ashish, mitigate and lessen the effect.
No, not at all. It has no bearing on the COVID.
Close friend Zareen Khan, she had, she was COVID positive, but she seems to feel that her pneumonia and flu shot gave her a very easy bout, considering she has some comorbidities. She sailed through and was fine in 5 days.
She was lucky. It had got nothing to do with the flu shot.
No credit to the flu shot that she took. Credit probably to her immune system and the doctors who treated her.
Yes. Okay, so what we need to think about is, if we are exposed, if we are in the front line, if we are interacting, doing social work with people who have been COVID positive, we need to take the flu shot. Otherwise, we wait for the COVID shot. Am I right?
Nisha, the flu shot only hopefully prevents you from getting the flu, which has symptoms similar to the COVID. So, suddenly you get fever and you're going to think it's COVID. So that aspect of perhaps of the illness goes away. So you are most likely not to get the flu, the non-COVID flu, and therefore you are that much protected. So you're not going to self-doubt whether this fever is a COVID or a non-COVID.
Non-COVID.
Yeah. Again, it's actually it probably it probably prevents you from getting a common cold or a common flu. But there are also reports that even if you get it, I mean, it's not 100% that if after a flu shot you may not get a common cold or a common flu. It would probably be less severe. So what you talked about, Zareen Khan taking up a flu shot, if she had a normal flu, it would probably be blunted response and it would not be too much of a problem for her. But it has got no correlation whatsoever with COVID. So please don't mix the normal flu shot with COVID. They're two different things. It does not offer any protection for COVID.
Okay, that's an important input. What are the danger signs, Ashish? Besides, I mean, the lack of smell and the fever and the oxygen going down. What are things that people, because there's something new that came up just around a few weeks ago about rashes and a kind of a nettle rash that seems to be a new
Yeah,
symptom.
that actually is a very rare thing. It got reported somewhere, I think in Long Island. It was for the kids as a pre thing to some multi-organ failure. But I think that's more of a hype. I don't know whether in regular COVID patients, Rahul will say whether that's sort of a rash, but I think that's a rarity. In medicine, there are things which are rare, which should not be brought on table.
So
And Rahul,
what are the danger signs to look out for?
the only danger sign is your oxygen saturation going down.
But Ashish, a lot of people have 98 and 97. I mean, my friend Paul
No,
Verghese
so
was
that's
in
fine.
hospital right now, and he had 98
Oxygen.
saturation, and he was in a very bad way. And he's, in fact, that's my next question, Rahul, about people who have, been feeling very, very panicked and literally, something that you discussed with your in your Times of India interview last month, about how it's much worse than people anticipate when they go in there and they're breathless and they have to take oxygen. But coming back to oxygen saturation, a lot of patients actually still have a 97 and 98 saturation. How
So
would you explain?
they are safe. No, they are safe. Of course, it's not 100% or 98. It's less than what their body is used to. It's like somebody strangulating your throat and you're not getting enough air for 8 hours, 10 hours. So obviously you're going to be weak. Your organs are used to a certain oxygen level for their best performance. So that is a little bit less. It's like shakkar thoda kam in the chai. It's going to be not as tasty as with the shakkar. So once the oxygen is slightly low, there are side effects of fatigue in different variable forms, but they are not in danger. Their life is not in danger so long
Okay.
as the saturation remains above 94 consistently. Rahul,
Okay.
please.
Yeah. So what we need to know, Nisha, is that we need
Yes.
to be one step ahead of the virus. So
Okay.
there is a concept which came out very clearly. One of the concepts which has come out very clearly in the corona pandemic is a concept called as happy hypoxia. Okay.
Yes.
And then there is something called as a hidden hypoxia. Both of them sort of mean the same thing. Happy hypoxia means that a person may have a lower saturation of below 94, 93% and may not be displaying signs of respiratory distress. Or the silent hypoxia is that they have a saturation of 98, 99%, but you make them exercise a little bit. So that's where my 6-minute walk test comes in. You make them to walk a little bit and the saturation promptly drops down below
I
94%.
Okay.
So we have to basically catch the patients at that stage. If you catch a patient when the saturation is already below 93, that means you actually missed out a silent hypoxia stage. So if you catch those patients when their saturation is dropping down on mild cardiorespiratory exercise, and I'm talking about a simple walk test done at your own pace, not a vigorous or a rapid or a brisk walk, just a simple walk within the room, and if the saturation goes down, they have to report to a hospital at that time. And there are various things the doctors could do at that time, which will actually avoid them from going from that stage to a hypoxic stage at rest. So we need to be one step ahead. And people often don't do that. They keep on testing their saturation. The virus actually gives such a large amount of fatigue to these patients that they feel fatigued to even walk for 5 minutes or 6 minutes. And often they miss out on the walk test. And that's when they'll report to a hospital with hypoxia. If they do a walk test morning, evening, the meticulous patient who stays at home should do a walk test morning, evening. And as soon as the saturation drops down, they need to report to the hospital. Not at the rest. It has to be at the inducible hypoxia.
I want to bring this showering. When you take a shower, I think that's one of the most physically draining activity. So people who test positive and those who feel fatigue, our advice is please conserve your oxygen. So just a basic birdie bath, no glorious showers when you are in that zone of, struggling with hypoxia, because it's a physically very, very draining. A lot of people have actually collapsed in the bathrooms. And
I
this
see.
is where they are utilizing too much of their oxygen and suddenly going down in the saturation. So
I
be
think
very
that
careful. Just basic toilets and a very basic shower. Otherwise, rest, rest, and rest. Conserve the oxygen. Oxygen saved is oxygen earned. That is the dictum in COVID.
Very important.
showering is almost like a 6-minute walk test. So they
Yes.
can take a saturation immediately after shower, and if the saturation is low, that's another time to actually report to the hospital.
I see. So my friend Suparna Goyal has just recovered, and she is asking. She has never felt this degree of fatigue, and she wants to know, like a lot of other people who've written into me, about collapsing after having a bout of COVID. What is the reason that you see a lot of people collapsing? It's fatigue, I'm assuming, but is there something else one needs to watch out for?
You mean collapsing as in actually going
Falling down.
unconscious or something? Falling
Yes,
down or
down, that level of
no?
complete draining, being drained.
So that level of very, very profound fatigue is known to happen with viral illnesses. And in COVID, it has been predominantly the most common post COVID syndrome complication which people are seeing and people are reporting. It is like you work for 10 minutes and you feel that you have worked for almost 8 hours today, and you immediately want to go and take some rest. And that is almost like, your energy is drained out, and that's what people often relate to collapse, because they just feel like going and just going off to sleep or going onto the bed and sleep. And it takes weeks for it to improve. It requires a little bit of a exercise, it requires a little bit of a body training, it requires a bit of nourishment in terms of your nutrition and your hydration. It requires a little bit of a care for you to go back to the normal energy levels of what you were before the COVID struck you. So it is a very, very important post-COVID syndrome for symptom fatigue.
And I'm
Nisha,
hearing
sorry,
that.
I want to say that a disproportionately high fatigue is probably the single most distinguishing factor of a COVID from a non-COVID fever or a flu. In these regular flus, you are tired but never really fatigued or exhausted.
Right.
In COVID, you are disproportionately, you think the fever was only 100 or 100.5, but the fatigue is like Rahul was saying, in 1 hour, maybe you work for 10 hours. So disproportionately high fatigue is the single most defining feature of the COVID.
Disproportionately high
Fatigue.
fatigue is the distinguishing factor. We need to remember that. So is that linked to the fact that patients with COVID are very high risk for heart attack and stroke?
Okay, interesting. So there are three things which happen in COVID in the body. I'm going to talk a little bit medical here, but I'll try and simplify it as much as we can. The first thing which happens is the classic pneumonia. So which we all see that the lungs got affected. And here, though, if you've seen the picture of a COVID coronavirus, it's basically got those spike proteins.
Spikes,
The
yes, yes.
spikes which are there are actually having a very high affinity to something called as the ACE2 receptors in our body, ACE2 receptors. And those receptors are quite prominently present in our lungs. So we get that pneumonia which happens. That's the first thing which happens, which obviously causes oxygen to go down and stuff. The second thing which what Dr. Bhumkar alluded to before, is that the COVID doesn't do anything to you quickly. It doesn't like strike and in 6 hours you're knocked down. Uh, Around the second week of symptoms, you have the phenomena which is called as the immune or a cytokine phenomena, where the body starts reacting to this virus and the dead proteins of the virus which are present in your body, and mounts up an immune response, which actually starts harming your own body as well. So it actually worsens your pneumonia, worsens your hypoxia, can affect other organs as well, like kidney and heart and stuff. And the third thing which can happen is it can start forming clots, small microthrombi, which is the third thing which happens in COVID. And these microthrombi can happen in your heart arteries, the coronary arteries, can happen in your lungs, can happen in your kidneys, and they can go and block the blood supply to the vital organs, and then cause an increased risk of stroke or a heart attack, which is what we are seeing. So almost 30% of the acute strokes and heart attacks which are coming to the hospital right now are testing positive to COVID. So they don't present as COVID-19, they present as a stroke or they present as a heart attack. And when we diagnose this condition that they have a stroke, for example, we send a COVID-19 because all of them are being suspicious of having COVID-19. And almost 30 to 40% of them are coming back as positive. So they were never aware that they were a COVID patient, but they
Yeah.
presented to the hospital as some other problem and tested positive for COVID.
So, Rahul, is there something that can be done to mitigate this? Because it's sounding very horrific.
No, no. They can anticipate it. He will tell you the blood test that they do. They can anticipate who's likely to develop the clots and what is to be done. Yeah,
So,
Rahul.
yeah, so if you have, so first and foremost is to identify the symptoms. Many times, more often than not, when history is taken from these patients, they would say that a week ago they felt a little feverish, or they were profoundly drained out and they were really fatigued, but they chose to ignore it. Those are the patients who had probably low or no symptoms at all, minimal symptoms at all. Okay, so there are a list of blood tests which we do. One of them is something called as a D dimer, and the other one is a CRP. These two are very important. A D dimer test, which done and interpreted by a doctor, not by the patient. Uh, Appropriate steps can be taken to give this patient some amount of antiplatelet or blood thinning agents so that such a complication can be avoided. And a rising CRP along with the symptoms of COVID is something which a doctor should basically interpret as a problem and should start treating the patient actively with whatever stage that illness is in. So, in the first few days, you may choose to give oral medications. In the second or third week, or second week, or towards the end of the second week, he may want to give intravenous medication, including if the oxygen goes down, steroids may be something which could be necessary to be given to the patient as well.
So, Doc, two things. One is something that was touted as manna from heaven, which was steaming and gargling with hexadin, which was meant to be even better than any other cure in the world. And a lot of people from coming out of China were touting this as, as the reason for there being less fatalities in China. One is that, and second was, of course, remdesivir, and which I alluded to earlier, ivermectin. Are these, I mean, obviously you deal with them separately. Are these two things not proving to be,
Effective.
efficacious anymore?
I think only a ENT surgeon can answer the first question.
No,
I
no.
should not be even answering the first question.
Yeah. See, regarding the gargling and the steam, the theory is that heat kills this virus. I think on that basis, people are actually burning or scalding their throats and noses. Now, tell me, if you're going to wash your hands for 5 or 10 seconds or 1 minute, are you going to be virus free for the next 24 hours? How long can you steam? In theory, even if you believe that the virus is going to be killed by the steam, for how long? While you're taking the steam, maybe it is dying. That also is not true, because the virus actually enters the cell. And that's when it's not like lying on the surface like a cockroach. And at that time, you sort of with the steam kill it. The steam works mainly in the upper airway. The gargling is actually restricted only to such a small part of the throat that that's not the normal area of the virus to reside. It's the back of the nose, so gargle really does not reach there. But of course, the throat soreness goes away. To imagine that the gargling or taking the steam is going to prevent or kill the virus before it kills you is a misnomer. It's good to do it in moderation. It just gives you that sense of well-being. And more importantly, it gives you the sense that you are in control of your health or you're doing something. So I'm not against it for its other benefits. But this, to think that it is going to go and kill like we swat a mosquito, is not how it works. In fact, many people are actually damaging their lining because they are taking so much heat that they can't tolerate, and then it's all getting lacerated. So in very moderation, the only proven drug in this is, there are medical papers, is povidone iodine. Even a 0.5 percentage povidone iodine is known to work, but it works only for about 20 minutes. And this is where it has come into our consultation rooms, into the dental offices. They make the patient gargle. So for 20 minutes, hopefully, that area is relatively free of the virus. So that's about the only medically this thing. But otherwise, all the kada,
So only
Marathi we say kadyala kadun taka. Kada and kada means take it out. Yeah.
Check it out.
so Doc, where does
Regarding
HCQ
remdesivir,
stand in the pecking order?
yeah, the drugs,
HCQ,
medicines.
which was which was, touted as the best thing that ever happened to
So
COVID.
Rahul is sitting
Yeah.
with a knife and fork. He's going to eat his words now.
Favipiravir, Remdesivir, ivermectin. What is? I mean, are we? Have we gone back in? Instead of progressing, are we left with nothing except for COVID and iodine, like Ashish mentioned?
So I'm going to talk a little bit in lighter vein first. In lighter vein, the media and everybody has sort of interpreted as if remdesivir is in search of a disease, rather than, as if remdesivir is trying to find out which disease can it work against. Because it started off with Ebola, and everybody said Ebola, remdesivir would work. That's where remdesivir first came in. And then we say that no, probably it doesn't work in Ebola. Avian flu probably doesn't work in avian flu. And now we are saying probably doesn't work in COVID-19 as well. I think we are asking the wrong question. Now, I'm not somebody who would believe out of the science. I believe in the science, and there is a randomized controlled trial which was done by WHO, which said that it does not change the mortality. And I completely agree with that. Probably, yes, it does not change the mortality. We should not be, throwing the science away, because that's where the evidence comes from. But maybe the question which we are asking is probably a little bit different. And then you will get the right answer. The question which we should be asking is it clearing the virus very quickly? And yes, there are studies which have shown that the viral clearance is happening with remdesivir. Secondly, does it actually decrease your stay in the hospital? Yes, it does decrease your stay in the hospital. It does decrease your stay in the ICUs as well. So these three questions probably still hold true. And that's why I think people who are still in support of remdesivir actually say that remdesivir should be continued to be used in the patients. And I feel we need to have some more data before we can actually completely throw remdesivir out of the treatment protocol. While the WHO is still contemplating whether to because this was an interim analysis which they did, and based on the interim analysis they've said it does not have a mortality benefit, but I think they may probably choose to continue the trial and let it complete before they make the final announcement. We don't know. We need to wait for the WHO guys to actually get back to us, so we are still waiting. I believe the meetings are going on between the principal investigators in WHO. I know one for sure was there yesterday, so let's see what happens with these meetings coming out.
Nisha, for the
So,
audience, it was about the timing of Remdesivir. I think that's where we were going wrong earlier. It was like the Bollywood movies, the policeman would come much later after the crime. So what has changed for Rahul and people like him to thinking is that Remdesivir has to come in early on. And early on you give, that's when it works on the virus, the multiplication. And I
Very
think
important.
that has been a change in protocol.
Very important input.
Yeah,
So
Rahul, correct me if I'm
has
wrong.
come
no, you are
early.
right. You are right. Absolutely, it has to be given early,
Come earlier.
and probably it will act well. The second question was about hydroxychloroquine and ivermectin. So
And
HCQ.
favipiravir.
So favipiravir, I think favipiravir has got evidence right now as an oral drug. Again, the evidence is limited to only few hundred patients done in 2 studies across the world. So it's not a very robust evidence. Ivermectin doesn't even have that evidence. So ivermectin is actually something which is an anti-parasitic medication. So we were using it for head lices and stuff, and now we are using the effect of that as an antiviral effect. Similarly, hydroxychloroquine is an original anti-malarial drug which has been used over several decades to treat a lot of autoimmune problems. So the safety of that drug was well established, and we have known for decades together now that it actually has some antiviral property, and that's why it was sort of touted as the best medicine to be used. Whatever webinars we did in the month of March and April, we are seeing exactly the opposite now. So
That's why I said he's
you
sitting with
know,
a knife and fork.
yeah,
Eat his own word.
exactly the
that
opposite now.
that
So
essentially is science. Please,
yeah,
people there, please understand science is dynamic, it is fluid, and doctors have to keep revisiting and revisiting. It's not that we believed that was right and we were doing it. Now there's evidence, so we are open to change. We are very often criticized that, but that time they were selling us this, and now they are, whatever evidence comes, you have to keep on modifying. Medicine is not arithmetic. 1 plus 1 is never 2. In arithmetic, 1 plus 1 is always 2 anywhere on the planet. But in medicine, it's not the same. So you have to be very alert, and you have to depend on these alert minds like Rahul to sort of analyze and how to go forward. So
absolutely correct. So um, I think it is something which we may again change in the next 6 months if we have a different evidence come to it. So what is the evidence which is good right now? The evidence which is good right now is that keeping an oxygen saturation of around 94% at least is definitely helped. So you should give oxygen to people who have saturation below 94%. And the second thing which basically came out in the one of the trial was that people who had low oxygen and who required some amount of supplemental oxygen or required machines like ventilator or a high flow nasal cannula to deliver oxygen to them benefited from steroids. So these two things have definitely come out as positive, and I think they stand a cornerstone of the therapy right now. So I think based on that, everything else is a supportive therapy. And if we look at mortality benefit in every intervention we do, we probably may not find the answer because the trials may have to be done in several thousand patients. But whatever evidence we have right now, we have to basically use it in the wisdom of our clinical knowledge as well as the patient's requirement, and then utilize it to the patient's best benefit.
So Nisha, this timing of the oxygen support and the steroid, this is where your triple layer network of doctors really helps. This is where you don't lose time, and this is where you can anticipate when are you likely to. This is why this chain of healthcare support is very important. To identify that moment or those few hours of when are you likely to need either of the two is what this three-layer system is for.
So Ashish, would this work in a house scenario or in a hospital scenario?
So the steroid is usually in an injection form, so it's not given given at home. For those who occasionally dip down below 94, a home environment with the oxygen concentrators are good enough. If the saturation is showing a jump, and if clinically, a lot of the times people are only sending reports. I said there's a huge component of a clinical examination. What is the feel of the patient? And that is where you need that doctor to see you. So if it is 93, 94 and feeling better, improving, then the oxygen concentrators are a good first aid. And sometimes some people have that transitory dip and then they keep on recovering. But if it remains the same or starts to fall down, then you are better off being in a hospital.
Absolutely. And so I come to the top 5 key advices that you would like to give to a COVID positive report, which is predominantly asymptomatic or mildly symptomatic.
So Rahul.
So yeah, no, I think the top five. I only have one advice, and that is follow your doctor what he says. For asymptomatic patients or mildly symptomatic patients, I think you need to basically most of you will get away without any medication as well. If you're mildly symptomatic, you can probably take ivermectin, doxycycline, which has got poor evidence, or you can take favipiravir at home, which has got a little better evidence than ivermectin, doxycycline right now. And most importantly, please do your meticulous 6-minute walk test. Stay in the house in a self quarantine room. Always wear a mask so that you don't infect your near and dear ones.
So the bigger responsibility is to protect your beloveds and be a very responsible. When you're mildly symptomatic, you tend to venture out. Do not do that. Do not spread the virus. As much as you owe it to yourself, you owe it to your beloved ones and the society. I think that is a very important thing for always wear that mask and not the valve mask for those who test positive. For sure, not that. They must wear the proper surgical mask or the N95. And of course, remain self-isolated at home as much
So
as possible.
Ashish, are you saying that a person who's been tested, who's cured and whose test is now negative, is it safe for such a person to be then moving around? Or when does a person become, non-infectious?
Non-infective.
Yes.
So I believe the data says, and Rahul will correct me, the first 10 days are when
Right.
you are at your maximum infectivity and slowly it starts going down. And once you're tested negative, I think then you are safe. Then you cannot really infect and give the infection to anybody else.
So is RT-PCR the conclusive test that has to be done?
So far, yes, we don't have an option, but currently the gold standard is the swab test done with the RT-PCR.
And where does the CT chest fit in?
So
Rahul.
CT chest is something which carries a good specificity and sensitivity. What I mean by that is that if you have some classic changes seen of COVID-19, you could be very much sure that this is going to be COVID-19 around 85 to 90% of the time. Okay, but it is not a diagnostic. It's not a diagnostic test. The diagnostic test is RT-PCR. CT scan is done by doctors to assess the damage of the lungs and to make a decision based on that. It cannot be used as a diagnostic test. A problem is a lot of people are opting out for CT scan and then not doing a test. And here they actually slip into the system where they are actively infective, and basically because they have not done their test, they have not been given this responsibility of wearing a mask or taking some medicines to protect themselves as well as their family and the society, and they keep on spreading it. I think that has come down. That has to come down more. We are actually urging the CT scan centers that whoever reports these CT scan findings which are suggestive of COVID, they need to report it to the municipal corporation so that the municipal corporation can actually follow up and get a test done on these individuals. So that's what needs to happen essentially.
That was a loophole which people found, because RT-PCR, the swab test, we had to let the municipality know, the municipal people, but a CT test you need not. There's no reporting yet on a CT test. Although it's more. Rahul, my question, sorry, Nisha, is does the CT scan clear out in 14 days those who test negative
No,
after?
no.
So that
No,
can't
so
be
that
reliable.
CT scan may take up to 6 or 8 months for it to clear and become normal.
6 to 8 months?
Yes, 6 to 8 months for it to become clear and normal.
Okay.
Up to, I'm saying some
Up
may
to,
some
yeah,
may clear
sure.
it in three
Yeah,
to four
yeah.
months as well. But certainly at 14 days, it will look exactly the same. You will have some resolving changes seen, which would be there, but it definitely can't be normal at 14 days.
So it's only
So
the
that's another problem. That's another problem. You do a CT, let the doctor interpret it that whether you have active COVID now or not, and that interpretation is based on your RT-PCR and your symptoms. Because for all you know, you might have had COVID 3 weeks ago, and you've done a CT today, and you are thinking, and I have COVID
just
now, when it
started.
was actually have been 3 weeks ago.
You're already cured of it. Yeah.
Yeah.
Ashish, please feel free to jump in anytime with questions.
Yeah. I'm doing, we are just chatting, Nisha.
Chat where
You are such a
so many,
wonderful host.
and this is not restricted to India. I have friends in Italy, my friend Lisa, my friends from London, my batchmates from Los Angeles and Paris. They're all watching you, and they've all sent hundreds of questions. I'm trying to fit in everything. Um, a quick question about something that has shocked the world, and that is the cases that have, re-emerged. The people who've already had COVID, and they, while it's a very tiny percent, what is your take, Ashish and Rahul, on
No,
the fact that
Rahul, I think Rahul has to answer this.
Yeah. Look, so reinfection is a reality. What we initially thought about the immunity passport which the infection gives you, which is basically the antibodies which the body naturally produces and gives you some amount of immunity against the infection. There are now a number of studies which have shown that by 3 or 4 months time, most individuals will have no antibodies present in their body, or they would be so negligible that they would be inadequate to provide them some amount of immunity from a reinfection. Okay, now there have been cases of reinfection. uh, Fortunately, the number is extremely small. There is no clear data which is emerged out right now to say that the reinfection is mild or is it more severe than the first one. So there are people who have reported mild infection. There are people who have reported more severe infection than the first one they caught up as well. The
Oh,
only way to conclusively say that this is a reinfection is when you have the first genome identified as well as you identify the second genome and say that there were two different genomes of the same virus which if infected you. That would be a very, very scientifically conclusive proof. But many times what happens is that you get a second infection after several months, 4 or 5 months of the first one, and you know then that it's a second infection. So you don't really go and dig out the genome and stuff out of that. So that's where the second infection problem is. Now, this is where the virus also becomes a clever virus. And this is where the vaccine also becomes a problem because you need to have antibodies which will be sustained for at least a year or so. As I said, vaccinating every time may not be easy. So we don't know how the vaccine is going to be delivered. When it does come, whether it will be a single one shot which we take and give us a immunity for 12 months, or we may have to take a booster dose at the end of 6 months or 12 months to keep the antibodies go longer. We just don't know about that. So my take home message on this particular question is, don't let your guard go down. Even if you have infection once, please continue the same amount of precautions what you were doing as if you never had infection before. So wear your
You're
mask,
likely
do
to
your
be as vulnerable. Yeah.
yes, you are likely to be as vulnerable as you were before.
So, Rohini and Rita would like to know, Rita Ved and Rohini Kapoor, that is it really practical to stay predominantly at home? I mean, should one start going about one's regular life with the mask, social distancing, hand washing? Is there anything more 7 months, 8 months down the line that we know of that we can do? And my additional question to this is that what do you feel about A, B, C, D, K, and zinc? I mean, are they to some small extent the saviors or at least boosters of immunity?
So I will take the first question about socializing, about because human being is a social. You remember Rahul said that you're most vulnerable when you drop the guard. So
Correct.
not so. What are those situations in our day-to-day life? This is actually when you socialize over a meal. If you meet friends and wear the mask, everybody is wearing a mask, there is no danger. That's what we doctors are doing. In the hospitals, we are treating patients. So we are not keeping, so the mask is on. Only when you meet over tea or when you want to eat, that is when your mask is down, you're talking, you're laughing. That's when the possibility is high. So I think we should meet people at non-eating times, or when you want to socialize, make sure that the mask does not go off from either persons or the entire group there. I think that about if you maintain.
And actually, typically people meet over drinks and
Yes,
dinner.
chai
So
pe
this
aa
is a
jao, khane pe aa
positive
jao,
quote.
yeah.
Yeah.
So that I think for a few months we have to sort of make do with that. Meet either before dinner, after dinner, before chai, and keep the mask on. Then you can yap and yap, no problems. But getting the mask down is the little vulnerable thing, is what I feel and I practice.
And Ashish, there are lots of, very fancy masks, sequin masks doing the rounds these days. But I happened to chance upon a graph that very clearly stated that the 95% and 99% protection is N99 and N95. And at a pinch, a surgical mask, whereas the cloth masks, which are, the fancy ones of today, only give you 50% protection. So what is the clarity and what is your
So
take on that?
I am not sure about the percentage. I think it's about 70% is what they say with the cloth. But I think the cloth mask at the practical level in the population has proven to be a safety measure, is what I think. And I think this N95 is only when you are directly exposed to the positive patients for the healthcare workers. This is my way of looking at it. So
Yeah.
maybe Rahul will
Yeah,
add.
I think I completely agree. For the healthcare workers, for people who are actually working in an environment which is probably likely to be COVID, N95 mask has to be used. N95 mask is not a practical solution for day-to-day life because it is a very, very thick mask. It actually causes a little bit of a suffocation to normal people who are not used to it. It needs some time to get used to it. And on a practical basis, it actually causes some amount of carbon dioxide rebreathing as well in many people. So we breathe out carbon dioxide, you tend to breathe in a little bit of carbon dioxide, much higher than what is there in the air normally. Okay, so
And
it's not
most are
for
not
common.
reusable, they are disposable.
They are
So
disposable and they are very expensive as well. So most of those masks are 100 rupees upwards and they are of one use and you need to throw them away. So surgical mask, the three-layered surgical mask, I think, offers a very, if worn properly, from the middle of the nose to the lower end of the chin, if worn properly, actually offers a very, very reasonable protection, provided everybody around you are also wearing a mask. The problem is that only one person wears a mask and the rest of them are not wearing a mask. That one person who is wearing the mask also has then a little bit of less protection because the masks are not 100% impermeable. They are porous. They allow some amount of exchange to happen. So everybody needs to wear a mask. If you're going to wear a cloth mask, I think you need to basically wear a 2 or 3 layer cloth mask, which will offer a little bit extra protection than a single layer cloth mask. And there is no role for any fancy mask. The mask has to be clean. The mask has to be dry. So whenever you're going out, carry extra mask with you because if the mask becomes moist, and very often it does get become moist because you're talking, you may have a little bit of runny nose or just the moisture from your mouth would basically make it moist. Moist masks are basically likely to have carry the more infection around. So you need to change it to a dry mask. So carry 2 or 3 masks with you and always wear a dry mask when you're talking.
Okay, so it's risky to wear a wet mask.
Yes.
Okay, that's
Just
an important.
recently I met Rahul and I learned something from him. He carries an extra mask with him in his pocket. And I said, why do you do it? He says, what if this rubber band breaks? If it snaps, what? Then he's in a hospital setting. He's probably in the ICU, so he quickly has another one. So having a backup is also a very
Having
good
a
idea.
spare mask.
Yeah.
Having a spare mask and never wearing a wet mask. That's very important, and I don't think we knew that. Um, and you were going to tell me about the A, B, C, D, K, and zinc.
Okay. So this is the immunity concussion or the immunity cocktail which people talk about.
The
All the
alphabet
vitamins,
soup. Yeah.
vitamins taken up in a soup and had it. So let me put up one thing to rest here. There is nothing called as immunity boost. You either have a normal immunity or you have a low immunity. I have not come across any medical terminology where it says you have a hyper immunity or something like
You
that. Okay,
can
there's no,
charge your phone, but not
yeah.
charge up your immunity.
So you have a normal immunity or you have low immunity. Now, people who have normal immunity go much beyond these ABCD ABCD things. So yes, they form a very good component of your immune system, but you also need good 8 hours of sleep. You also need good exercise habits. You also have to have these vitamins and these proteins taken up from nutritious diet. So you need to do a lot of things together to be able to bring up your immunity. And immunity boost up happens over several months. It does not happen in one day's time. So you can't take up these tablets and say my immunity is up to the speed now. You need to basically keep on taking it for several months before you can say that my immunity is now probably normal. So normal immunity is what we should be aiming for. There is nothing called the immunity boost up.
Okay, and is it beneficial when you're going through COVID to be lying in a prone position?
Yes, so that's another thing which has actually proven medically. So I'll tell you there's a reason for that. When you lie on your back, the normal way we all sleep, you have the majority of our lungs, the way they are structured, majority of them actually are towards the back. So in the front, you have your heart and the major arteries and the vessels coming out of the heart and supplying the blood to the heart. So,
Right.
so actually, when you lie prone, all of these vessels in the heart tend to fall onto the anterior side of your chest, which is the sternal bone, and then allows your lungs to breathe better. Also, your secretion clearance happens better. Also, remember, air is always lighter. So when you lie prone, all the air comes and aerates your lungs from the behind. It all tends to go up. So the oxygenation is better. So there is medical reason why you would actually want patients to lie down prone, even if you're not deficient with oxygen. If you start learning how to lie prone when you have COVID positive, it will only help your oxygenation, and that's something which we have changed completely in our ICU. If you visit a COVID ICU, you would find that majority of the patients are literally asked to lie prone if they are awake, or if they are unfortunately on a ventilator, then we prone them while they're sedated and ventilated. We prone them electively for several hours a day. That's one of the therapies which has worked well, and it has been proven in randomized controlled trials as well now that it actually helps to improve your oxygen saturation.
So
Nisha, if you allow me to make a joke, which I tell
please,
my patients about the
please do,
ABCD,
please do. We need some
about
lightness
these
here.
vitamin supplements, I just tell them, and this is for your audience because they belong to a certain social, I think it is only a way of making your urine expensive. All these damn things are just excreted through the urine. They really give you no benefit, but the pharma share price goes up.
So Ashish, then are you saying that we need to focus? I mean, we need to stop looking so much at our taste buds in this critical state that the world is going through, and we need to look at diet more focusedly.
Yes.
And I want to intertwine this with another question coming back to my friend Beena and Paul, who are suffering from very severe exhaustion. They've just been discharged from hospital. So how, is diet the key pre and post?
So the pre I can, but the exhaustion Rahul will address because he
Okay.
sees this patient, and I'll speak about the nutritional supplement later. Yeah. Rahul, if you can
Yeah,
address her friends who
yeah.
are
So
just discharged and very exhausted.
this is something which we see very often in our post-COVID OPD. And what I basically relate this to is one, um, they have just recovered from a very bad disease. Some people may be even mildly symptomatic, they still would have this kind of exhaustion or fatigue which would be present. So you need to have a multi-prong approach. So the first approach is that you need to have good 8 hours of sleep. So that's very important. Many times we tend to sort of spend a lot of time writing, reading, or watching TV. I think they need to have good 8 hours of sleep. The second thing is good nutritious diet. So away with the junk. Go back to your mom. She knows how to feed you well. Or ask your wife or whoever cooks for you to actually cook what we call as the home food. And home food is a wholesome meal. I am talking whether it's vegetarian or non-vegetarian. You need to have a wholesome meal. It cannot be just one thing today and then you have a whole lot of calories taken up. You need to have a balanced proteins. You need to have balanced fats in that. You need to have some carbohydrate. Everything needs to be balanced up. So a wholesome meal is what you want 2 times a day at least. And then I think very important to have a digital detox. I actually prescribe them digital detox 2 to 3 hours a day. So stop the phone, stop WhatsApp, no Facebook, no computer. So 8 hours of sleep plus 3 hours of digital detox gives you time away from corona and corona related news for almost 11 hours in a day. Because right now, whatever you switch, whether it is
It's
TV or Facebook, it's only COVID and COVID. And that mind, it is very important that you have. So lot of this fatigue has to do with your mental well-being as well. If you start feeling mentally strong, a lot of these post-COVID patients have got mental health issues, and they are not that they're mentally ill. It's just that they start feeling that, am I going to be normal ever? Am I going to feel the same amount of strength what I had before? Why was I the victim of COVID? Why did it happen to me? How did I catch it? When did I catch it? And so on and so forth. And God forbid if they have gone through a torrid time during the illness,
I see.
then this is even more. The mental issues are even more. So I think this digital detox actually might sound funny, but it's very important to keep it away so that you have some time with your friends, families, you talk to them normally, and you get out of this whole COVID thing, because it's very important to get COVID out of your mind. If once it is out of your mind, the fatigue goes away.
So Rahul, Chris Como some time ago went through COVID, and he had talked about Ashish. He talked about chest exercises through COVID. I mean, would it even be possible for a person suffering from, a bout of COVID to start doing chest exercises?
I think he just means deep breathing, probably. Chest exercises, probably, because in the phase of pneumonia and consolidation, I don't think you can really do. But if you don't have that, na Rahul, please
Yeah,
help me.
so what we do is we do order them something what we call an incentive spirometer. So that's a bedside small
With the
gadget
balloon
which has got a little ping pong
ball.
ball which
Yes,
basically floats in the air when you suck in air. So it's
yes.
like you're sucking in air through a tube and the ping pong ball sort of floats in the air. That helps you to expand your lungs slowly. So it's not a vigorous exercise. It's actually an exercise which is done at rest. And we always tell the patient not to exert too much, but to build it up. It's like slowly training yourself for a marathon. So you start off with say 200, 300 ml of air being sucked in, and you gradually build up your lung capacity, which can go up to 2.5 liters, 2,500
So
mils
this
as
is
well.
during the illness while the patient
So this
is
is no, this is after the illness, so
after. So
after
sure
the acute
question is
phase.
during. Yeah,
During the illness, there is just probably breathing exercises are limited to just deep breaths and lying down prone. That's what helps you.
I see. What are the what is the post COVID scenario? What is the post COVID map? Are there tests that need to be? How should one watch out? I mean, how does one know that one is actually recovering?
Yeah, so lot of simple things can be done. One is that you come to know about your energy level, the fatigue which we mentioned. The second thing is many people actually complain that they can still hear the heartbeat, or many people are now very vigilant. They all carry a pulse oximeter, and they find out that the basal heart rate has gone up by 10 or 20 beats. So they would know their basal heart rate was 70, for example, before, and they say it's consistently 90 now. I have patients who come and tell me even better. They say that while I'm sitting or resting, the heart rate is 90, but the moment I get up or I start walking, it goes to 110. So this inflammation or this process of healing takes again several weeks for it to come down to baseline. The healing may be in the heart muscles, the healing may be in your body, the healing may be in your cells, and all of this can be reflected by the heart rate going up or your breathing rate going up a little bit. So it may take up to a couple of months for it to settle down. So most patients will have their heart rate come down to a baseline what they had before COVID in say a month or two. It will not be before that. And this is only those patients who suffer it. There are some patients who just have no problems. They are absolutely as fine as they were before, and they say that I had no problems at all post COVID. So they are the lucky ones who probably had a very strong immunity and didn't allow the inflammation to get better of them.
The simple blood test, Nisha, that CRP that Rahul spoke about, C-reactive protein, I think that is sort of a scientific way to know that your body has come to its original state of equilibrium. It's one of the simplest, very inexpensive tests. A simple blood test tells you CRP. Now you are back in the normal range.
Yes.
And you're saying besides a few chest exercises, breathing, and 8 hours sleep, and a balanced diet, a normal Indian balanced diet, which has all the components of natural vitamins, is what matters. Nothing beyond that, is it?
And the Mastiwala mind.
You need to get corona out of your mind.
Digital detox.
You need a digital detox.
It is the fear of death that is the most anxiety. I think you should not fear death. I think you should, that is
But
what.
but Dr. Ashish, there have been very sudden deaths. I mean,
Sure.
Absolutely unprecedented when a person is, getting cured, everything looks great. The patient is being told that he's going to be discharged, and he suddenly pops it. So,
These are the micro clots that Rahul was talking. These are the patients who were developing these little clots, and suddenly the clot was either attacking the heart or the brain. Classically, I think this is what was happening. Rahul, fill me in.
I think you're right.
Almost on the verge of a discharge, and this is like a vascular accident that happened, which honestly can happen to anybody at any time.
right.
Just that in COVID, the blood clotting mechanism gets little altered, and these micro clots, you're more prone to that. Nobody looks at how many people get a heart attack in the non-COVID times. So there are people who get that too.
So another thing is this hypoxia which goes unnoticed. So not particularly the hospitalized patient, but patients who are at home, they are so they feel so normal despite being hypoxic. That hypoxia goes unnoticed for several days, for several hours, and then typically they they suddenly collapse. Another set of patients which basically have had these medical emergencies come across is patients, especially elderly who were on a 2 or 3 liters of oxygen or 1 or 2 liters of oxygen, wake up in the middle of the night to go to the washroom, for example, take out the oxygen, go to the washroom, and as Dr. Bhumkar already described, that any amount of exertion, as simple as passing urine, is a stress to the body at that time. And then suddenly the oxygen levels drop down, and they are found unconscious, or they have a medical emergency in the bathroom. So those are the things which have certainly happened. Another thing is this inflammation, which I was talking about. You can have sometimes your heart muscles involved in it as well, and what we call as medically a myocarditis condition. Suddenly you can have a abnormal heart rhythm which may rapidly progress on to cause a cardiac arrest. So there are certain things which have basically contributed to these sudden deaths, but majority of them are what Dr. Bhumkar rightly said, the small clots, the microthrombi, which have caused this. So we need to be aware of what we can prevent. So one of the golden rules is that if somebody is on oxygen, they are not allowed to get out of the bed in the night. Whatever they have to do, the business has to be done in the bed. In the morning, when people are around and it can help them to sort of go to the washroom or something, it's a different thing. But in the middle of the night, everything has to be at the bedside. Don't take out the oxygen. That's a golden mantra.
I see. Very important. So, for all the hundreds of questions pouring in, I'm not going to tax Dr. Rahul and Dr. Ashish with regular questions about, pre and post. Dr. Rahul is an intensivist. So, I have focused on the situation of COVID when you go through it and how to come out of it gracefully without really going into all of your neighbors and their problems. I'm going to address that next Tuesday at 4:30 with another team of doctors. For now, I am just wanting to show immense gratitude to Dr. Rahul and Dr. Ashesh, who very kindly, in the middle of their work day, and you can see they are still in their surgical
This is
gowns.
also part of our work, Nisha. This is also, I mean, educating the people, making them, feel stress-free is an important part of our work.
This is a very, very important, part of COVID, to dispel so many misnomers and myths that have been invading our, digital world. Like Dr. Rahul said, we need to take everything, with a pinch of salt. We need to listen to this webinar all over again and hear very carefully what Dr. Rahul and Dr. Ashesh have said. Dr. Ashesh, is there any other consideration?
I think you are fabulous. No, I
Have
think
I covered?
Yeah, I think you covered the entire bandwidth. But like he said, the 3 vaccines that you have: mask, social distancing, and the hand wash, and the 3-layered healthcare system. I think these should be the.
Yes.
And also, I think it's too early to premeditate what
It's
long
not gone. It's not gone. It's not going. Beware. Don't let your guard down.
And also, Ashish, it's too early to premeditate what are the long-term repercussions of having the virus. Am I right?
Yes, very much so.
Yeah,
Yeah.
we're sort of getting a hint of it, but we still don't have the whole gist of it. So we just know what it may do what it may do in long term, but we need to wait and see.
So I want to actually say I'm sorry if some of your questions haven't been answered, but like I said, we are back at 4:30 on the next Tuesday, same time, same place. But I've tried to cover nearly 150 questions, concising them into 1.5 hours. I can't thank you enough, Ashish. Like I said, friend, guide, mentor, and fabulous, loyal friend that you are. And thank you for introducing me to this Farishta, Dr. Rahul.
You should let Rahul give his phone number. That will be your biggest gift to your audience.
Rahul. My phone number is available on the net all the time. You just have to Google Rahul Pandit contact, it will come up.
And he's so kind, although he's so busy, he'll always. But he has his layers of urgency, which he decides when should he urgently reply. So if he's on a webinar and if somebody there, he'll go off. But if the answer can be delayed according to him, he'll reply to you after an hour.
Thank you so much.
Wonderful, sir. Yeah.
You've been very generous, and I hope we can have you again. When more questions come up, when we go deeper into this situation, when we cross perhaps a year, I would be honored to have you. But for now, it's been a privilege to speak to you. Your easy demeanor, your hands-on approach, your kindness and your compassion, matched only by our beloved Dr. Ashesh Bhumkar. I can't thank you enough, and I feel I've gained another friend and mentor. So thank you once again. And again, thank you to all my sisters, all my friends, my COVID group, for always for my Bombay Women Achievers forum. Thank you for egging me on, motivating me, and encouraging me to do this. A non-medical person speaking in medical parlance only comes from you. Thank you so much.
Yeah, you did well. Absolutely fine. Thank you very much.
Thank you so much.
Bye-bye. Everybody take care.
Thank you. Take care. Bye.
It's a privilege and an honor. Thank you.
Honor, likewise.
Iqbal, should I come on that computer and shut this and just request you to let's sort